Globally, as of 3:07 p.m. Central Europe Summer Time, the 6th of October 2020, there have been 35,347,404 confirmed cases of COVID-19, including 1,039,406 deaths reported to WHO. WHO Europe continues to encourage individuals to take care of their own health and protect others by washing hands frequently with water and soap or using hand sanitizing gel. Maintaining social distancing, keeping a distance of 1 meter, 3 feet between yourself and anyone who is coughing or sneezing, avoiding touching eyes, nose and mouth. Following respiratory hygiene, covering your mouth and nose with your bent elbow or tissue when you cough or sneeze, then disposing of the used tissue immediately. Seeking medical care early if you have a fever, cough and difficulty breathing, and staying informed and following advice given by your health care provider, national and local public health authority, or your employer on how to protect yourself and others from COVID-19. The characterization of COVID-19 as a pandemic does not change whose risk assessment and recommendations, which stress that countries should adopt a mix of interventions based on an analysis of the local situation and context, with containment as a major pillar. WHO Europe, in line with global guidance, recommends that all countries increase their level of preparedness and strengthen alert and response systems to identify, manage and care for new cases of COVID-19 and communicate risks. Countries should prepare to respond to different public health scenarios, recognizing that there is no one-size-fits-all approach to managing cases and outbreaks of COVID-19. Each country should assess its risk, the measures in place and their social acceptability, and rapidly implement the necessary interventions at the appropriate scale to stop or slow down COVID-19 transmission, while minimizing economic, public, and social impacts. For all countries, the final aim is the same: stop transmission and prevent the spread of the virus in order to save lives. You can reduce your chances of being infected or spreading COVID-19 by taking some simple precautions. Regularly and thoroughly clean your hands with an alcohol-based hand rub or wash them with soap and water. Why? Washing your hands with soap and water or using alcohol-based hand rub kills viruses that may be on your hands. Maintain at least 1 meter, 3 feet distance between yourself and others. Why? When someone coughs, sneezes, or speaks, they spray small liquid droplets from their nose or mouth which may contain virus. If you are too close, you can breathe in the droplets, including the COVID-19 virus if the person has the disease. Avoid going to crowded places. Why? Where people come together in crowds, you are more likely to come into close contact with someone that has COVID-19, and it is more difficult to maintain physical distance of 1 meter, 3 feet. Governments should encourage the general public to wear a fabric mask if there is widespread community transmission, and especially where physical distancing cannot be maintained. Why? Masks are a key tool in a comprehensive approach to the fight against COVID-19. For more public advice on masks, read our Q&A and watch our videos. Avoid touching eyes, nose and mouth. Why? Hands touch many surfaces and can pick up viruses. Once contaminated, hands can transfer the virus to your eyes, nose or mouth. From there, the virus can enter your body and infect you. Make sure you and the people around you follow good respiratory hygiene. This means covering your mouth and nose with your bent elbow or tissue when you cough or sneeze. Then dispose of the used tissue immediately and wash your hands. Why? Droplets spread virus. By following good respiratory hygiene, you protect the people around you from viruses such as cold, flu and COVID-19. Stay home and self-isolate even with minor symptoms such as cough, headache, mild fever, until you recover. Have someone bring you supplies. If you need to leave your house, wear a mask to avoid infecting others. Why? Avoiding contact with others will protect them from possible COVID-19 and other viruses. If you have a fever, cough and difficulty breathing, Seek medical attention, but call by telephone in advance if possible and follow the directions of your local health authority. Why? National and local authorities will have the most up-to-date information on the situation in your area. Calling in advance will allow your health care provider to quickly direct you to the right health facility. This will also protect you and help prevent spread of viruses and other infections. Keep up to date on the latest information from trusted sources, such as WHO or your local and national health authorities. Why? Local and national authorities are best placed to advise on what people in your area should be doing to protect themselves.